need to protect yourself also, and especially also to protect the reputation of your institute. So over the next half an hour, we'll be discussing about different things. We will be starting from the MR infrastructure and zoning planning, potential dangers of MRI. We'll be discussing the safety signages that have to be put up. What are the contraindications for MRI? There are a lot of questions are asked about the issue of pregnancy, whether MRI is safe during pregnancy or not. So we'll be discussing that. We'll also handle some emergency situations, the use of gadolinium, which is a contrast agent, and I will also touch base on a few points about the current scenario, COVID and MRI during COVID times. So one thing, more important things to understand is that MRI magnet is all the times. It's 24 hours round the clock. The magnet is at full power. So MRI console room or MRI suite is an active magnetic field all the time. So everybody has to be aware that even when the MRI is not being done, the machine is switched off, the magnet remains on, and the pulling power of the magnet is always on. So one has to be very, very careful before entering the MRI suite. So when I was discussing about the, just trying to say about the planning of the MRI infrastructure and zoning planning. So the zoning system for safety reasons have been into 4 categories: the zone 1 to zone 4. Zone 1 is the area where the normal patients and the MR personnel all are present over there. And beyond this zone, so at zone 1, all the people who are in the hospital are available to, they can move around till zone 1. Beyond zone 1, there should be a barrier where in zone 2 is the area where only the patients and the MR personnel or radiology personnel are allowed to enter those zones. This is the zone 2 area where all the washrooms would be here, the changing zones would be here, and this is the area where the patient interacts with the MR personnel or MR personnel interact with the patient. And as far as possible, only patient should be allowed within this zone and not the attendants. So this zone 2 area becomes very, very important for triaging of the patient. Zone 3 is the area where it lies between zone 2 and zone 4. Here only zone 3 is again very critical area. Anything which moves beyond this zone 3 area is in the zone 4 area. So zone 3 area patients who have been screened by documentation, screened by metal scanners, they are only allowed to enter zone 3 area where MRI safety personnel, senior MRI technical staff again interacts with the patient. And zone 4 is the MRI suite itself where nobody can enter who has not been screened, and he only enters along with the MRI, senior MRI staff. So we need to understand that if we fail to demarcate these zones, then we are ready for disasters to happen. We should be ready for that, because if people are allowed to have free access to zone 2 and zone 3 and zone 4, then the disaster is going to happen, and it's going to be bad name for the department, for the hospital, and for the institute. So again, reiterating the MRI safety patterns in the zone areas, you can see the MRI zone 1 is the MRI access area through which you enter into zone 2, where it is the limited area when a patient screening and patient preparation is going on. Zone 3 is again restricted access only to the screened patients who have been screened to metal detector, and MRI personnel are there. And zone 4 is the final MRI suite area. Signages, the FDA has approved some of the signages. Signages should be very clear and glaring to the eyes. Danger and high magnetic field. The term warning does not convey the importance of the situation, because it can be, very potentially hazardous situation can happen if precautions are not taken. So the signages should be very glaring and right in front of your face. So these are the signage issues there. Anybody who comes into this area should see these signages so that one is cautious. Why do we understand that why MRI suite area is so important? So from safety point of view, because MRI magnet is very, very high magnetic field. So it is 3 Tesla magnets. We measure this in the terms of Tesla. 3 Tesla magnet will have a intensity of 30,000 Gauss. And just to understand the difference is that Earth's magnetic field is 0.5 Gauss. So you can understand that how much more is the pulling power of the MRI magnet. These are potential projectiles that can happen, accidental things which can happen in the if we are not taking the safety measures. All that kinds of things like intravenous catheter trolley, the beds, the chairs, the wheelchairs, all can be pulled into projectile. And when patients are sitting over there, the patient can also be pulled, and sometimes has a very disastrous and hazardous complications. So why did the potential projectiles? What are potential projectiles? Any ferromagnetic object like iron or steel or even nickel, anything, any object which has these items, these metallic things, can be pulled into. They are also said to be ferromagnetic because they get positively charged during magnetized during in front of the magnet, and they have a projectile effect and they pull to the core of the magnet. So if any object, let's go back to the slide. If any object is lying somewhere, say here, it will pull to the center of the magnet, go to the magnet in no time. So any of these things, your cell phones, the keys, glasses, hairpins, coins, pens, everything can be pulled into this core of the magnet. So all these things have to be kept aside when you enter the MRI suite. So many times when we, when we scan the patient, we see that there are a lot of artifacts coming, and we find out these artifacts could be related to some coins, and we can try to search there are, we see all kinds of objects stuck to the core of the magnet. So all these things can be a potential projectiles. There is small items, they will not cause injury, but of course these things will get destroyed. So again, remember this mnemonic, MRI means metal results in injury. So no metal should be there within the MRI suite. Some questions to understand whether there are some biological effects of a static magnetic field. So many questions come to people's mind whether the long-term deleterious effect of MRI is there, which can it cause some kind of neoplasm if somebody is going for MRIs repeatedly? Does the field have effects on the patient which alter our monitoring, or does the field have effects on implanted medical devices such as maybe cardiac pacemakers or intravenous catheters and all which have been placed? So does MRI magnetic field harm these things? So all these questions are there in people's mind. One thing is very, very clear, that MRI has till now, there's no evidence that it can cause any risk of any kind of cancer. So repeated MRIs are safe. They do not cause any harmful effects. There are limited harmful effects which of gadolinium contrast that we use in MRIs that we'll discuss later, but MRI by itself does not cause any kind of harmful effect. The magnet, if we take all the safety precautions, the magnets are always very, very safe, and anybody can do n number of MRIs without any problem. We're trying to understand for technical staff, it's very important to understand that what kind of magnetic field, what kind of forces are there. So there are two types of forces. One is the translational force, and the other is rotational force. Translational force called the missile effect, the projectile that we say, and rotational effect is rotational force is called the rotational effect. So speaking about translational force, this force describes the force which attracts various object to the center of the magnetic field. So translational force is greatest when the difference in field strength across the object is greatest. So when somebody enters the MRI room, MRI suite, at the entrance, the translational force will be maximum because the area of it depends upon the difference in the magnetic field of the two objects. So, and this can cause projectile effect. The rotational force tries to align the object along the long axis of the magnet, and it has a rotational effect. The translational force is the most dangerous because all the projectile things can be called with the translational force. There is also something called fringe field. The fringe field is because the magnets which are on all the time, and it can spread beyond the core of the magnet. So it can be within the MRI suite room. It can sometimes extend beyond the MRI suite room also. So you have to be very clear in your mind that the fringe field, which is active all the time, and the fringe field is active all the time, and it has a force which can be even beyond the core of the magnet. So that's why we come to site access restrictions. So who are the personnel who are supposed to enter the MRI suites that we need to determine? And what we need to see that all the personnel, whether they're MR personnel or whether any hospital staff or patients or doctors, for site access restriction should apply to everybody. So we propose two kinds of training, trained kind of personnel, level 1 personnel, level 2 personnels. Level 1 personnels who are minimally trained in MRI. So anybody in the hospital who is working in the hospital, healthcare worker, or even our back-end workers like IT persons or engineering persons should have level 1 training. What I propose is that everybody in the hospital should be given this kind of training so that we can are able to avoid catastrophic and hazardous complications. So say for anesthesiologists who come to the MRI room for the anesthesia purposes, they should also have level 1 qualification, that they should be knowing certain things about the MRI magnet, what things should be taken inside and what should not be taken inside. Level 2 personnel are the trained MRI personnel who are doing the MRIs all the time, and they are more aware of the MRI environment, its hazards, its equipment that can be used, and they can take all the safety precautions. So it is important to appoint an MR safety director in the hospital within the Department of Radiology, and all MR radiology technologists and doctors and radiologists should be level 2 personnel and should be aware about the greater depth about the knowledge of the MRI functioning. Site access restriction again, it should be applied to everybody, and any patient who has to enter the MRI suite has to go through screening, proper screening, and all the screening should be documented. These are some of the examples of the accidents which can happen because if we are not following the MRI's zoning system, or we are not training people for MRIs. So this is what happened, is a revolver getting stuck in the core of the magnet. This happened sometime back in Bombay 2 years back. And this is somewhere in Sweden, which is happening. And this is also somewhere in the US where 6-year-old boy was killed because of this safety measures were not taken. So to avoid all these things, we need to take all the safety measures. MRI screening forms have been designed where screening everything, every detail the patient is mentioned. Besides the demographics, we talk about the implanted metal implants within the body or any kind of device which has been applied. All these things should be mentioned in the form. So these are the forms. You see multiple things are entered, and whatever things which can be mentioned, all these things can be entered. These patient forms should be filled by the patient itself, because patient himself or herself, because the patient would know exactly more about whatever operational surgeries which have been done. Or if the patient is not able to fill because of any reason, family members, and if that is also not there, actually the referring doctors. So that somebody who is more aware about the patient fills up these forms, because if anything is not documented, then it can be catastrophic again. And for us, for the radiologist personnel, for the radiology technicians who are getting trained, it is important to understand it's a very, very important document. And if something goes wrong or something happens, this document will always be used. So even for medical legal point of view also, this document is very important. So it's very, very clear that you should try to get this form filled. All the columns need to be checked, and the patient should understand everything. Patient should not be given the form to fill himself. You should be there to guide the patient to understand what exactly is happening, and this patient's signature and should be important documented. And these papers should be documented and filed. Patient screening and contraindications. There's some implant or devices which are contraindicated. We'll discuss this later. If the subject answer to any device says yes, then we need to understand what exactly the device is, and that issue has to be addressed and resolved before we take the patient into the MRI suite. So cardiac pacemaker, defibrillators, we'll discuss in detail. They were first in the absolute contraindication list, now in the relative contraindication list. We'll be seeing in details. Any injury of falling foreign body can be contraindication to MRI scan, especially if the injury is within the eye. So that has to be complete absolute contraindication. Any bullet injury, again, we need to see whether the lodged bullet is lying where in the body. It can be seen by X-rays or through CT scans. You can do a check CT scan, try to understand the lodged bullet. The location of lodged bullet is close to very vital organ, say for aorta or important organ, then MRI should be avoided. There are certain items which can still take within the magnetic field. It can be brass, aluminum, plastic. But if you're not sure of any object, then please understand it. Please discuss with the MRI technologist, and then only take it inside. So these are the items currently in the absolute contraindications list. So this is a triggerfish contact lens, the device where this chip is inserted and the ophthalmologist collects the information. There's the insulin pumps, there's implant temporary transvenous pacing leads. These are the devices currently which are on the absolute contraindications list. Maybe later on alternative models can be created which are safer to the MRI and they'll be taken off from this list, but currently these devices are into the absolute contraindications. Then there are so many devices which are relative contraindications. Relative contraindications means that some of the devices, based on the make and the companies and the capacity of the power of the magnet, some of the devices can be, the patients can be scanned in the MRI with some of the devices, but in certain conditions they cannot be used. So they are under relative contraindications list. But once these devices are mentioned in the MRI screening form, all of these has to be studied whether this can be taken within the pregnancy, within the MRI room or not. So again, some of the cochlear implants and intracranial vascular clips, for earlier they were in absolute contraindication, but now they are relative contraindication because MR safe, MR conditional devices have been manufactured, which can be scanned within the MRI room. MRI patients can be scanned with these without causing any damage. These again pacemakers, ICDs and pacing wires and loop recorders, they were again previously in the absolute contraindication list. Now they are in the relative contraindications. Pacemakers, patient can, if a patient pacemaker has been implanted, then they can be scanned in MRI only after 6 weeks of placement. But only all the studies must be performed at 1.5 Tesla. We need to understand one thing, that we hear so much about MRI safe devices, or MRI compatible devices. But actually, those MRI compatible devices are a misnomer because they are MR conditional devices. They are supposed to work in certain conditions in MRI, and most of these devices have been tested at 1.5 Tesla, so they are safe to work at 1.5 Tesla. Many of these devices cannot work or get malfunction in 3 Tesla. So these devices are called MR conditional devices. Nothing is MR compatible devices. All these are MR conditional devices. So in the case of pacemaker, they can be patients with pacemakers can be scanned after 6 weeks of placement at 1.5 Tesla MRI, and we'll see later on with some other precautions which need to take. So these are again pacemakers and cardiac devices. These are some of the pacemakers which are available in the market. So these are MRI conditional which can work within the MRI system, MRI suite, without any malfunctioning. So this is an interesting website, MRIsafety.com, which is run by Dr. Shalab, and it's a very important website. All the technical staff or radiologists should know about this website, and all kinds of information there on the website, even about the devices. If you know the name of the devices which has been implanted in the patient, you can go and check the name of the devices. There's always these devices carry some numbers. You can put the numbers and you can see here on this website whether these devices are safe to work on 1.5 Tesla or 3 Tesla, whether they're MR conditional or MR compatible, MR conditional or not. All the information one should have on this MRIsafety.com. So I would recommend that all the radiology staff should visit MRIsafety.com and get some reading material from it. Specific guidelines for patients with pacemakers. As you're coming back to pacemakers again, patients who have been implanted with pacemakers can be taken up for MRI after at least 6 weeks. They are supposed to be taken up only at 1.5 Tesla scanners because, again, when the MR conditional devices work only at 1.5 Tesla, the patient should not be non-pacemaker dependent because the pacemakers need to be switched off during the period of examination. And these scans should be done actually during the daytime with electrophysiology physician who is available or a manufacturer representative who switches it off and resets after the examination. So it has to be planned. So patient with pacemaker, if MRI has to be done, it has to be planned. It has to be planned with the availability of the electrophysiology physician or the manufacturer representative who has to sit through the examination, he switches it off, the pacemaker, and during the examination is performed, and after the examination is done, the pacemaker is reset. So all these conditions need to be fulfilled before we do the scans with patients on the pacemaker. And remember, 1.5T is the magic number over here. 3T devices, 3TMR are not safe for pacemaker study. Shrapnels, many of the bullets are, although they are non-ferromagnetic, but they can be contaminated with ferromagnetic substances. Again, they need to be seen whether in the location, where they have been lodged, and once it is determined, if it is found that it is safe, then we go ahead and do the MRI. Otherwise, we end up doing CT or any other device, any other investigation. So many times we get a question where coronary stents have been placed, whether scans can be done with coronary stents or not. Of course, yes, the coronary stents are always safe here, and commercially available coronary stents may be imaged at 1.5T or 3T anytime. There's no wait time. So if the patient has been implanted with a pacemaker today and say in the night he develops some neurological symptoms, he has advised for MRI, he can be taken up for MRI. But only thing we can do is that we can reduce the time of investigation. So with coronary stents, all the coronary stents, we can go ahead and do MRIs whether in 1.5T or 3T without any problem, but just reduce the scanning time. So many questions are already discussed about safety of MRI during pregnancy. Earlier it was advised that during the first trimester of pregnancy, MRI should be avoided, but later on new studies are coming up which show that exposure to MRI during the first trimester of pregnancy has had no deleterious effect with respect to non-exposure of pregnancy, non-exposure of MRI to the fetus. So it is still understood that MRI is relatively safer during the first trimester of pregnancy. Later on, it can be done. We do fetal MRIs where we try to understand the growth abnormality in the fetus based on the ultrasonography findings. So fetal MRI, the fetal MR echocardiography is also cardiography is also performed. Cardiac MRI, fetal cardiac MRI is also performed. So later on, absolutely safe. First trimester was an issue which appears to be resolving nowadays, but the use of gadolinium, contrast agent, should be avoided because that is still an issue and which we are not sure about the safety features of gadolinium. So still it is not sure, we are not sure, we should try to avoid gadolinium. If at all it has to be done, then it should be under informed consent where the patient, the clinician and the radiology staff and radiologists should all sit together and understand risk versus benefit, and they should do the risk versus benefit analysis and then go ahead with doing the gadolinium contrast. So for MRI, pregnancy and MRI, MRI can be done anytime, but not the use of gadolinium. Another issue is employees who are pregnant, can they be in the MRI environment? Of course, they are not supposed to be in the CT environment, but the MRI environment, they are very safe. They can be in all the zones from zone 1 to zone 4. They can do all kinds of things. Only thing is that while the MRI scan is going on, they should not stay within the suite room, MRI suite, that is the zone 4. They can do the positioning of the patients and they can come back to the console room and do monitoring of the patients from there, but they should not be within the MRI suite when the scan is being done. For employee safety, the safety measures should be applied to everybody, whether it's MR personnel or radiology personnel or hospital workers or anybody. Employees safety is for everybody and everybody should be aware of this MR safety. There should be no exceptions. So we do get to see certain burns which can happen, and these burns are also because of certain cables. Sometimes these cables get heated. So if these cables are placed and they are looped or touching the patient's surface, patient's skin, then because of the heating of the cable, the burns can happen. So when we place the ECG cables, we should see that they are not touching the patient's skin. Similarly, peripheral nerve stimulation has also been described by certain patients. Very important thing is about MRI quench. So it's a very dangerous situation. It needs to be tackled in a very competent manner. MRI scanner supercooled with inert gases with helium. So now these cryogens can boil off anytime, either intentionally or accidentally, and this can be a very terrible situation. Sometimes we need to do intentional quench. For example, we saw a projectile effect when bed got stuck into the machine. or the patient is sitting on the bed and bed is lying on the bed and bed is stuck on the machine. So to remove that, we need to switch off the MRI situation and bring the magnetic field to 0. So this is called intentional quench, and this can be sometimes accidental quench also. So MRI technical staff, MRI personnel should be knowing about the quench situation. They should be trained to handle the quench situation. If the quench occurs, remove all staff from the room immediately. The patients have to be removed and the staff have to be removed because there's a fear of asphyxiation and frostbite. Emergency shutdown switches are there. That switch should be available at the control of the senior MRI personnel or MRI director, and he can switch it off for emergency quenching situation. During these times, it has to be again taken away and has to be very careful that nobody from the hospital staff, people carrying all this kind of stuff, when there's an emergency situation, all these people can run with all this stuff, but they have to be stopped at the MRI room. So it again becomes the important role of the MRI personnel or MRI technical staff to stop outside people with these kind of stuff inside the MRI room. And all the patients need to be taken out immediately, but no code, like what you say, code blue or anything should be performed within the MRI room. They should be performed outside of the MRI room. So patient and the staff should come out of the MRI room, and all whatever has to be happen, it has to happen outside the MRI room, not within the MRI room. Talking something about the contrast agents. So gadolinium is a contrast agent of medicine, which is done for again imaging in the MRI situation. It is a paramagnetic substances which can add up to the information, and it's very commonly used, but it has got side effects, but the side effects are very, very minimal, not very significant. Some kind of headache and coldness can happen. Severe anaphylactic reactions can happen in very small percentage, 0.001. That means 1 in a lakh patient will have this kind of thing. So it's relatively very safe contrast agents, but still we need to take certain precautions. The issue of retained gadolinium, it made a lot of news in last 2 to 3 years in Europe, America, because it was scanned. Patients who have been scanned repeatedly, they get these kind of white spots in the white deposition in the globus pallidus and dentate nuclei, and this is because of gadolinium. So it was found that this is mainly because of linear compounds of gadolinium and led to the withdrawal of linear compounds. The polycyclic compounds have come in. Many of the companies who were selling the linear compounds, they were forced to withdraw the products, and then they have also launched new products, the cyclic compounds. Until now, it has not been reported in cyclic compounds. Nephrogenic systemic fibrosis, again a very severe complication of MRI, which again is not very much commonly reported nowadays. Earlier it was a common complication which is reported. It leads to firm edematous indurated plaques of the skin, and can be sometimes gadolinium can get deposited in the lungs, heart, diaphragm, liver, and kidneys. So for this, what we need to do is that we need to do EGFR calculation of the patient. So EGFR is, besides the serum creatinine, it can take into account patient's age, sex, to come to the conclusion of calculating EGFR. EGFR practice is very important, and this should be the ideal practice for calculating the GFR for assessment of the renal function. This should also be used for the CT contrast and MRI contrast also. We use calculate the EGFR. We ask the patient to get the serum creatinine and EGFR for all kinds of patients who are undergoing MRI contrast, and especially patients with diabetic patient or patient renal transplant, liver failure patients, chemotherapy. It's mandatory, can never be skipped. So we get the serum creatinine done and followed by EGFR method. We calculate the GFR, and then we take a call whether, when the values of GFR, we take the call whether MRI should be, a contrast should be safe in these individuals or not. So this is how nephrogenic systemic fibrosis looks. Recommendations for based on EGFR, whom to administer, whom to not, gadolinium. So if the EGFR is calculated to be more than 60 ml, gadolinium is safe, can go ahead and do the scans, no problem at all. If it is less than 60 millimeter, it can still be there can still be no problem, but one has to be cautious. And if there is less than 30 milliliter per minute EGFR is there, then MRI should be avoided, or very informed consent should be taken. But there's certain contrast, the class 2 compounds We'll discuss the class components, class of components later on, with class 2 components where MRI contrast can still be given when the EGFR is less than 30 millimeter per minute. If the patient is on dialysis, the MRI should be done just before dialysis. Some centers, they avoid dialysis, but it can still be done. So this is about the class of compounds, the gadolinium compounds. This is group 1. They are mostly composed of the linear compounds. Now most of them have been withdrawn from the market or reduced in use. Focusing now on group 2 compounds, which maybe gadobutrol or gadoteridol or gadoterate. With the gadoteric acid introduced by the GE, the Clariscan, the Getavist, deuterium are relatively safe compounds. NSF has not been associated with these compounds. Even retained gadolinium is not associated with these compounds. These are class 3 compounds, group 3 compounds, which have been recently been introduced in the US market. Probably they are not yet available in India. Again, linear versus polycyclic compounds. The linear compounds were supposed to be linked with NSF, or they were also for the deposition of pigment deposit retained gadolinium in the brain. Now, most of these compounds have been replaced by polycyclic compounds, and since then, there has not been much report about NSF or the retained gadolinium compound. Maybe we'll know it later because they have been introduced recently. All these contraindications agents should be avoided in patients less than 2 years. So, because in our country also we don't have a clearance for use of in patient less than 2 years. So, actually contraindications or relative contraindication for use of contrast is again EGFR less than 30 relative contraindication, pediatric patients and pregnant patients. MR safety training, it is for everybody, all who are within the MRI radiology department or MR magnet rooms, working the MRI rooms, whether the technical staff, whether nurses or whether the support staffs, the general duty assistants, all should be knowing at least the level 1 training should be given to all of them so that they can take precautions while moving in and out to the MRI suite. Important things that keep the MRI room closed all the time, and it's again the responsibility of MR personnel, somebody who is handling the MRI, and sole responsibility. Keep when the scan is done, lock it. If the access code is given, the access code should not be given to everybody. If the site will lock and key, then keep the key with yourself, and it should not be shared. So when the scan is going on, or even if the scan is not going on, the MRI suite should be closed all the time. A few slides about the safety features during COVID-19. ACR guidance say that MRI should be avoided. Use of MRI should be avoided if the patient is tested positive. Or it can be minimize the use of MRI except when absolutely necessary. All the non-urgent and non-emergent exams can be postponed. Impact of the results of the imaging must potentially affect imminent clinical management. So idea is that we should be trying to avoid MRI during patient has been tested positive and try to look for alternate methods. Maybe CT can solve almost all the problems till the time patient turns negative, COVID negative. Once turns RT-PCR negative, then we can, of course, MRI can be used. If MRI has to be used because of any reason, it cannot be avoided, then MRI room, once the patient has undergone the examination, the disinfectant protocols can take up to 60 minutes. When the patients are inside the room and the support staff is there, or nursing staff or doctors in there, they have to see that their mask that they're wearing, they should be MR compatible or conditional mask. There should not be any metal strip within the mask. Maybe a metal strip has to be removed or tape has to be placed. Similarly, for PPEs, personal protective equipments, the ferromagnetic components should be removed and maybe replaced by tape before you enter. So these are recommendations for doing an MRI. So, and during COVID-19, we should try to avoid MRI, try to do with CT. If it's not handled, we need to do it. Then with all these precautions, we need to do it. That comes to the end of the session. Thank you very much for listening. And I hope I have been able to put forward this information, and I hope that everybody understands whatever we have been talking about. Thank you very much.